Back again here on Safe Space on our 10 Tampa Bay YouTube page. I'm Ryan Bass. I'm just so happy to have you here once again. I'm one of our anchors here at 10 Tampa Bay. Do me a favor, hit that subscribe button so that way you get notified each and every time we put out a new episode here on Safe Space. Today's topic is super important, especially for where we are in today's day and age. It's titled Coming Out and Opening Up. And the focus is on mental health in the LGBTQ plus community. You know, I live here in a beautiful city, St. Petersburg, where not only is your identity and your sexual orientation accepted, but it is widely celebrated. We've got one of the biggest pride parades in the entire state of Florida here in St. Pete. Unfortunately, that celebration isn't on the same playing field everywhere else in America. And you know what? Today, we're going to chat with an incredible woman who dedicated her life to helping this community thrive and working on the mental health of those that live and work and breathe and are a part of this LGBTQ plus community. You're going to get to know Abby Maher, who just finished getting her master's degree at Northwestern University. She specialized in working in the LGBTQ plus population. She's licensed right here in Florida. She does a lot of clinical work, but when she's not doing that, she's also volunteering a part of the Trevor Project. She's with the Human Rights Campaign. She's also a member of the Florida Association of Lesbian, Gay, Bisexual, and Transgender Issues in Counseling. Simply put, she is incredibly equipped to have this conversation and to broach this topic with us. So on this episode, we're going to get into the common mental health struggles in the LGBTQ community and the importance of erasing those stigmas. Nearly half of the LGBT youth in this country last year seriously considered committing suicide. Think about that for a second. Nearly half. It really is a sobering statistic. And we're going to explore how truly just a simple showing of acceptance can make all the difference in the world. And finally, we're going to get into the era of the openly gay athlete. It really is something that has changed the landscape as far as being accepted in today's world. In the NFL, in the NHL, in the Olympics, the openly out athlete is something that we're starting to see more and more of. And that is inspiring our younger generation to embrace truly their own identity and empowering that age of acceptance. I'm so pumped to get into it. So here we go, coming out and opening up with Abby Maher. Really, really, really excited to have Abby here joining us. And look, this is such an important topic, Abby. And you and I have kind of been going back and forth over email on this. And, you know, I could tell you're passionate about it. I could tell how much you want to help, you know, the LGBTQ plus community. And I'm just so excited that you want to spend some time here and talk about such an important topic.
Right. No, I mean, I'm thrilled to be here and talk about it. I think it's anytime we get the space to broadcast more of these topics and make it more normalized. If anyone's watching that just needs to hear that they're not the only person out there struggling with mental health or the only person in this community struggling with mental health, like anytime I get the chance to talk about that, I'm going to jump on it. So I'm excited to be here. And I thank you for creating this space to do that.
No, and that's what this space is for. And you hit on it. I hope that anyone that watches this feels like they're not alone, that there is help out there, that there are others that are going through this too and are battling some of the same feelings and emotions. And I just wanted to start on that because the prevalence of mental health illness, and I feel like the word illness gets a bad stigma with it, right? But I would say the prevalence of mental health struggles in the LGBTQ plus community, it's wide ranging. I mean, I was just reading some statistics. One study suggests that 39% of those that have come out and have identified in that community have openly reported having a mental health issue in the last year. And that's just those that have reported it, Abby. I'm sure that it's much more than these numbers suggest.
Right. And I would absolutely agree with you there. And that a lot of times when we look at statistics in the LGBTQ plus community, generally professionals accept that they're probably underreported, right? Because in order to access this community and to do research on this community and gather that data, that requires people to be open about their identity. And there are a lot of people who, for one reason or another, are not able to be open about their identity. So when we're looking at gathering data, a lot of times it is underreported. And I would argue that those numbers are probably quite a bit higher than they're reported, which is quite sobering, right? Because some of the statistics are pretty sobering in this community.
It really is. And Look, and I've been open on previous episodes of somebody that goes through some of my own mental health struggles, and I see a therapist and I seek help, and it's a constant work in progress, right? I mean, I've been going to therapy for 4 years now, and constantly there's still things that I'm fighting and battling through. But in terms of the LGBTQ plus community, because you have done so much work, you have really dedicated and made it your life's mission to help those that are struggling in this community. With some of the people that you work with and some of your clients, what is the most common struggle? Is it depression? Is it anxiety? What do you see that's most common among those that struggle mentally in the community?
Right. I mean, it's pretty wide ranging, right? And something that I think is really important to hit on when we're talking about how there is an increased risk of mental illness or mental struggles in this community is that we want to move away from the idea that it's because of their identity, right? And so a lot of times when people ask me about what do people in the LGBTQ plus community come to counseling for, they assume it's about their identity or that they're struggling with their identity. And that's oftentimes not the case, right? And before we dive into that, I just want to make a point that there has been a stigma in the community that being not heterosexual or not cisgender is a mental disorder, and that is the reason for the mental illness, and that's simply not true, right? When you think about people in the LGBTQ plus community are living in a society that pushes shame on them constantly. They're at increased risk for discrimination, for rejection, for trauma, all of those things combined, that is the reason why we see higher rates of mental illness in this community. And so when people come to me, it's really wide ranging. I have people that are coming to me because they're stressed in their day-to-day life, or they're experiencing anxiety, or they've been rejected from their family due to their identity, or maybe they just want to explore their identity, right? And so it is kind of all over the place. Just like with any community, people can come for many different reasons, right?
Just to hear you say rejected from their family is it's heartbreaking. It really is, because I feel like, and again, you've done a lot more work in this space than I have. I feel like we're getting to a point now where you're starting to see a lot more conversations and a lot more people revealing their true identities that aren't afraid to kind of hide in the shadows anymore,
Right.
and are being more open with truly who they are. And we see that. Look, I living in St. Petersburg, we've got one of the biggest pride festivals here in the entire state of Florida.
Right.
And it's really one of my favorite months, Pride Month, because you just feel the love and the passion and the community and the togetherness. And, just to hear you say family rejecting it breaks my heart.
Right. And it is really, really terrible. And even looking at the statistics, like we were talking about earlier, LGBTQ youth specifically that have been rejected from their family are 8 times more likely to attempt suicide than those who are not rejected by their family. And that statistic has been tested over and over and over, and we know it to be true, right? And that's something that's particularly concerning, especially when we're talking about suicide, because a lot of these statistics relate to things that we can directly change, right? So when you look at the statistics, even things like people who are trans or non-binary, if they have their pronouns respected, they're half as likely to commit suicide as those who don't have their pronouns respected. And that's something you could do right now, right? You can respect someone's pronouns, not reject them from their family. And that's something that I really try to focus on, is that these statistics can be incredibly sobering and incredibly scary at times even, but they're all related to things that even if you're not part of the LGBTQ plus community, can change in your day-to-day life and that you can help. And that's something that I'm really passionate about hitting on, because it's something as simple as respecting someone's identity can be the difference between them wanting to veer towards suicidal ideation or not.
I'd like you to dive a little bit more into that, because I think it's really important, because, it's respect. It's, the opportunity to be open and accepting of others as well, and kind of what they're going through and who they identify as. And I think you mentioned the key part there. Like, these are simple things that we can do, not just in the LGBTQ plus community, but ourselves, those that are heterosexual can help this community cope with mental illness and can really make a huge difference.
Right. I mean, we even look at things like just an LGBTQ youth person having one accepting adult in their life makes a drastic difference in their mental health. And when we say accepting adults, that just means saying, hey, I appreciate who you are, I celebrate who you are, I see you for who you are, and I love you for who you are. And that feels pretty simple, but a lot of times that's not the experience of people in this community. Right. And it is, when we talk about this, it is really important because suicide is such a huge risk factor in this community. And there are so many things that we can be doing to reduce that, but unfortunately, they're just not happening as frequently as we would like, right?
Well, and suicidal risks among the youth, you mentioned the statistic. I saw the Trevor Project, which I know you've done some work with as well, said that 42% of LGBTQ youth in the year of 2020 to 2021, 42% seriously considered suicide. You're talking about nearly half,
Right.
nearly half.
Right.
Then that, I just wanted to resonate with those watching that this is a community that is struggling with mental health. And I know that mental health has become a very, a very popular topic now. We're starting to openly discuss it. And I think that's so great. But what can we do to help our youth not think that they need to take their lives
Right.
to be able to deal with this?
Right. And that's what I was getting at, is that there are things just as simple as respecting their identity, respecting, whether that means respecting their pronouns, respecting their sexual orientation. Just showing respect to youth can make the difference. Because I know when we talk about suicide, it can feel incredibly overwhelming, right? It's an overwhelming topic. There can be a sense of helplessness, like, what do I do to help? It doesn't have to be these major overhauls of things. It's showing respect to the people in your life, to the people in this community, letting youth know, hey, you are loved for whoever you are. And honestly, because of who you are loved and accepted. And there is a whole community of people out there that wants to embrace you and wants to celebrate you. Because a lot of times those messages gets lost in the noise of all of the stigma and all of the shame that unfortunately is pretty prevalent still in society. Although we have made strides, like you said, I know we have made huge strides, but still quite far to go.
We definitely have a lot more and a lot further to go. But I think one thing that really helps, Abby, and I've been so pleased and happy to see that there have been more athletes now that have come out and have openly, been just truly honest with their identity. Seeing Carl Nassib, who played for the Bucks here, who I've covered, who I watched, who I've been in the locker rooms with, to be able to hear him come out and openly say, yeah, I'm gay. And he's the first active NFL player to do so. And I'm sure him being a trailblazer will lead to more athletes feeling comfortable to do that. You have, one of the Preds players, Luke Prokop, who came out and said that he's living his authentic life, coming out and identifying himself as a part of that LGBTQ plus community. How much does that help, our youth? And how much does that help in that community to feel that level of acceptance, looking up and seeing athletes like Carl and like Luke, who are so strong and who are coming out? And I don't even want to use that term because, it becomes news. Right. Because, we're not used to it. And I hope there becomes a day where this is just normal. Right. But how much of an inspiration is it to our LGBTQ youth to be able to see those athletes do?
Right. Oh, it's incredible. I mean, it's amazing, right? Because so often, especially in our youth, people in the LGBTQ community are told that you have to choose between your authentic life or being successful in whatever terms we deem that, right? We don't get to see very many happy ending stories. We don't get to see stories of success and just achieving this greatness and getting to be authentic and open about who you are. There is not a lot of representation out there for that. So for these youth to be able to look at and say, this person is gay and they achieved this and they have success in their career and they don't have to pick between having this happy, successful life and being authentically out about who they are, that is huge. Because so much of the messaging is that you will have to pick, or you will have to hide part of yourself away in order to have success or in order to achieve your dreams. And so for an LGBTQ youth to look up and say, I don't have to pick and I get to be who I am and I get to share it with other people and I can achieve my dream and go after my goals, it is massively impactful.
But that's shifted in years, right? Because I feel like it doesn't. And look, maybe I'm ignorant on this topic, and that's why we're here talking with you, because you can shed more of a light on it. But I feel like in recent years, part of the reason why we've seen more of our population and a spike in those that identify is we're getting to a space where I think the LGBTQ community feels more powerful and feels more open to be able to speak up. And I think that reverberates and truly. It makes a world of difference.
Right. And you're right. We have made massive strides, especially honestly in the most recent years, towards more acceptance, more celebration, more visibility. where these people that have probably been hiding parts of their identity for a bulk of their lives now feel comfortable and safe enough to say, you know what, I'm going to be honest about who I am, which is wonderful. The downside to that, though, is, and this is not something a lot of people consider, but that as we have more visibility of what it means to be not heterosexual or not cisgender, people are coming out even younger, which is wonderful and incredible. It also is exposing people to more risk of discrimination, more risk of rejection at a younger age, right? And that's not to say that we don't want them to come out and be open and authentic about who they are, but we also have to consider that doing so is still risky. It is still not a safe experience for everybody, and it's still not accessible for everybody.
Well, and the social media age certainly doesn't help there, because
Right.
there is so much vitriol on
Right.
those mediums: TikTok, Twitter, Instagram, Facebook, and the list goes on. But you also see politically, and I'm not singling out certain parties here, but when you have transgender bills blocking female athletes from participating in female sports, that can feel like an attack on the community.
Right, right. And it very much does feel like an attack, right? Because what happens is, if you are heterosexual and cisgender, chances are you don't very often have the experience of turning on your TV and watching people debate whether you're allowed to live authentically or not, or watching people debate whether you deserve rights or you deserve equality. And and especially for our LGBTQ youth, to be turning on the TV, the radio, turning on social media and watching people fight over whether they deserve just what everyone else has naturally, that has hugely damaging effects. And I don't think that's something we always consider, that if we are privileged enough to not be in the LGBTQ plus community, we have less of a chance of watching people debate whether we deserve rights or whether we deserve equality. And it is everywhere. You're right. Social media has definitely not helped the situation. In a lot of ways, it can be positive because we have more visibility, which helps. It also exposes people to a lot more hate and a lot more criticism that can be really damaging for our mental health.
It certainly can be. And hearing that repeated and not feeling like you're worthy enough to just live a normal life that the heterosexual community does,
Right.
can be damaging and hurtful. I do find, and I just want to go back quickly to one thing, that the sports side of things, because I found it really cool to read. And this was a report in the Axios and Axios.com, that the Olympics featured a historic number of LGBTQ athletes. I think it was 142 are publicly out. That's more than have participated at all the other summer games combined.
Right.
I feel like we're reaching, and maybe this is me being optimistic here, but I feel like we're reaching a turning point. Does it not feel that way, Abby? And again, you're in this community, you talk to a lot of the people that struggle mentally, but I feel like we're in this turning point. You've now have the coming out Olympics, and you have mental health that is kind of that are merging lanes here. I just feel like it's a turning point.
Right. And you're absolutely right. Right. I think it is important, like, while it is important to focus on how far we still have to go, we are at a turning point, and it is still important to give people hope, to say, look, things are changing. There are communities out there that are accepting and celebrating and that are working to have the back of the LGBTQ plus community, right? And I do think we are reaching a turning point just in terms of visibility, right? So if you think back 10 years, it would be a lot harder to find openly homosexual people, openly transgender people, openly non-binary people than it is today. And to have that visibility it's incredible. Okay. And so I am glad to see your optimism, because that optimism is definitely there, and that hope is definitely there, that things are turning and things are changing. There's still a lot of fighting left to do, but we definitely are hitting a turning point, and that people feel safer to be authentic and to be honest about who they are. And like you were saying earlier, my hope is that it becomes just an average part of life, right? That it no longer has to be newsworthy or has to be a headline that someone identifies in a certain way, that people identify in all different ways, and that's just going to be a normal part of life one day.
I feel so encouraged hearing from you, and your optimism about how we are at this turning point. I do want to ask quickly, just for those that may be watching, whether it be, LGBTQ youth, which is such a critical part. And I think really building an infrastructure to show them that they're supported is going to be key to our future and to molding our future in acceptance. But for those that are looking for support, I know you've worked with the Trevor Project. Obviously, you're counseling and you are directly helping people. But what are some resources for those maybe that are watching, whether they're youth or adults or anybody that is struggling with their mental health in this community?
Right. Well, I'm glad you mentioned the Trevor Project because that is a hugely beneficial resource. They provide crisis counseling to LGBTQ plus youth. They provide a lot of suicide intervention resources. They also provide a lot of education. So whether it be for parents looking to talk to their children about sexual identity or gender identity, or just people wanting to explore their own identities, they provide so many resources in one place. We also have local resources like the Metro Inclusive Health is a wonderful one here, and they specifically have an office in St. Petersburg, and they will help cover costs of counseling. They will help provide recommendations for mental health counseling or for psychiatry services or even just general health services. We have things like Equality Florida that we can look to. And also more specifically, this is a huge win in recent years. We had just opened the first trans lifeline, which is a resource for transgender individuals looking for crisis intervention or support or just someone to talk to, mental health resources. So that is now open too. That just recently opened, which is wonderful.
I love to hear that. I absolutely love to hear that. And obviously you've spent some time here talking with me and on this series. How can people get in touch with you? And maybe they are hesitant to get counseling or seek help. And you're a warm, inviting face. So how can those watching get in touch with you?
There's multiple ways to get in touch with me. They can find me on psychology resources like Psychology Today. I am also on Therapy Aid. I am also on Therapy Den, which are all just, those are websites for helping to find mental health counselors, which I would direct people to anyway, because you can look through and filter. If you're looking for someone that's specifically LGBTQ plus affirming, you can put that as a filter on there. Just searching me by my name, they would be able to find me on there. So, and a bunch of other wonderful counselors on there that will also work with the community.
By the way, Psychology Today is how I got a hold of you as well. So I'm
very grateful,
very grateful for that resource. Abby, this has been such an important topic. And, I just feel like we are reaching a point where acceptance, love, and the openness about mental health will guide the next generation of those that are strong enough to come out and that are strong enough to be able to fight and work on their own mental health. So Thank you so much for taking the time. And I'm just so grateful to have you on.
Right. And thank you for giving me the space to talk about it. And I do want to say before I go, what you just said, if I could give any lasting message to anyone watching, it is that through all the noise and all the negativity, there are so many people out there that are ready to embrace your identity and celebrate your identity and love your identity. So I'm glad that you said that and you brought that up. But yeah, thank you for giving me the space to talk here today. This was really wonderful.